Hello everyone, this is Dr. Rajakrishnan. I am an assistant professor working in Essence College of Physiotherapy. We already saw an amazing video of muscular dystrophy, which is a case study and a DT based video. Now we are going to see an elaborate case presentation, which I saw in my studies, which I saw in my clinical postings and internship. There was a patient who is around 40 to 42 years old. He is having a type of Duchenne muscular dystrophy. He was affected with this DMD. So he came to our OPD in my college. He came with an report which is describing about he is having a Duchenne muscular dystrophy so and so for these many years. He's undergoing physiotherapy treatment, but it's not getting any improvement. Then we came there, and with our staff, we reassess the patient. The assessment is different with the reassessment. We have to reassess the patient, and we came to know he is not having DMD, he is having limb girdle muscular dystrophy. At the starting stages, he may have any DMD symptoms, but after that, it progressed into limb girdle muscular dystrophy. In the limb girdle, the name itself says it is affecting the limb and the girdles, like upper limb and the lower limb and the shoulder girdle and also the pelvic girdle. A total, it is of on the whole, it is affecting whole the body. It is not affecting any ocular or bulbar symptoms. It is not showing any symptoms like that. So we started the treatment from the scratch. From the day one, we started it. We started it PNF for all four the limbs, all four patterns, D1, D2 for all four girdles, and as well as all four limbs. After that, we will do some exercises like lying down from this side to this side, sitting up from down, and we give some postural exercises. After that, he managed to do all the exercises. After, if any other batches, after my batch, another batch of my same colleagues are going to treat him, he itself known all the exercises and all the pressures which is given by the therapist and all the sides of the directions of the exercises. He will teach the exercises to the therapist or to the intern students. From that, we learned if we didn't know that thing, if we practice that regularly, we came to know what it is good, what it is correct, and what it is not correct. So it comes in the practice. Maybe some beginners can't be able to do the same patterns and be able to give same pressures which is given by the senior therapist, but he politely insisted the therapist who is treating him and make them to do correct exercises. He is managing the senior therapist and also the interns. After that, he is, and a good thing is he will come by the two-wheeler to the treatment. As you know that the limb girdle muscular dystrophy, if it is progressing, he can't able to do the ADL activities. But he is still with his willpower. He is doing two sessions of physiotherapy, and he is managing to drive the vehicle, and he will walk from the corridor at least to 200 to 300 meters to the OPD, and he will manage to down the stairs, climb the stairs. He is doing by himself, not as with any assistance or with any other assistive devices also. He will do it by himself. In my intern period, he was there, and after that, he is one patient. Another patient is a child who is around 4 to 5 years. He is developing with the delayed milestones. We have saw that 1 and 3 years are the common years for DMD. Duchenne muscular dystrophy is affecting 1 year and a 3 years old child. Here, the child is with the Duchenne muscular dystrophy. He went through some other academies like in and around Coimbatore. There, they didn't give him the proper management. Like, we have to concentrate on the management from the developmental milestone for these type of children. We have to concentrate on the positioning first, rather than doing any activities, rather than doing any passive movements. We have to do positioning for these type of patients. If we do concentrate on these type of patients, the patients will become good. Your results are getting better. You can make any patients like this. If it is okay, then we can consider next patients with the same protocol, or we have to change the protocol from patient to patient. If the same Duchenne muscular dystrophy is there, same history is also there, but we have to assess and reassess, like learn, relearn, and we have to delete the process and repeat the process. First, we have to do the assessment, and we have to treat, and we have to reassess, and we have to concentrate where we are lacking. So it is very much important for these type of muscular dystrophy patients. We will see an interesting video of next series in the next month. Thank you.